A very good morning, student. Welcome back again. Now this video is for how to focus the slide. Okay, this is the slide where the tissue is there, stent tissue is there, and how we will see the image of this tissue under the microscope. So how to focus the slide under the microscope. At the beginning, most of the students, they don't know how to focus a slide under the microscope. The first step in focusing a slide is that you just put on the light. Okay, there is a switch on the back of this microscope here where you just put it on. Okay, and then you will see that there is a light has started coming from the source of the light. This is the source of the light which is on the base of the microscope, and there the electric bulb is fitted here and which gives the light source. Okay, so just this is the source of the light, and then the source of the light is passing through the condenser and the diaphragm. Let it pass through the condenser and keep the condenser and condenser down a little upward, and then of the diaphragm completely open. Okay, let it remain completely open diaphragm. Then second step is that you take this slide in your hand, clean the slide with the help of the tissue paper or the cotton provided to you, and then the important step in putting the slide is that you should put the slide where the cover slip should face upward. Okay, that how you will find out that the cover slip is facing upward. Just see this kind of the label will be there, and just read this label. This label should face upward. If your slide is not having this label, then touch the margin of the cover slip, and then you will come to know that which side of the slide is having the cover slip. Put the cover slip upward and put it onto the stage. And I have told you in the last video that this is the stage where you can put this slide, okay, with the help of the clip. There are the clip, and with the clip you can keep this slide. And then just bring the tissue, which is a stent tissue, which you can easily see with the help of this knob, okay, just onto the aperture, or there is a hole in the stage through which the light is coming, and on this light, okay, just see the tissue should come, that stent tissue should come just onto the top of this hole, and the light should be seen passing through this tissue. This is the another step. And then what you can do is that this is the nose piece where objective lens are focused, fitted. Then you bring the smallest lens, that is 4x lens, okay, which is also called as the screening lens, okay, and then bring this, okay, and rotate this nose piece till there is a sound of the click is there, and then this smallest lens will be fitted here. Then you try to see this image with the help of this eyepiece, that this lens is here, which is called as eyepiece, which is fitted on the top of the eyepiece tube. So I will just stand up and see this, okay, with the help of this, and then this may not be focusing, okay, because we have not adjusted the coarse and the fine adjustment which are far. So first I will move the coarse adjustment, this bigger knob, okay, and which goes up and down. I will rotate it, and then we'll see that when I will start seeing the image. Now I have started seeing the image by moving the bigger knob, that is called as the coarse adjustment. I can see it, but the image is very small. Okay, here image is small, the reason, and I can move this knobs of the stage micrometer here, and then can bring this and scan the whole slide, okay, because it is a small image. You can see the whole slide in this, and then once you have seen this whole slide, then you will like to go to that of the higher magnification, okay, higher, and the next objective lens is 10x. So I will just rotate this slightly to the 10x, okay. Once it has come to the 10x, again I will move the coarse adjustment, okay, and will try to focus it, and I will need to less movement. The movement will be very less with the coarse adjustment after 4x when I have brought it to the 10x. I am seeing the very good image here, and then here itself you should see whether your diaphragm is appropriately open, you need more light or less light, okay, whether you need to bring the condenser up or the condenser down. Okay, the more light will be there when the condenser is up and the iris or the diaphragm is open. So try to adjust with the diaphragm and condenser the appropriate light. How you will define that this is a perfect light? That means you should see a sharp image. Okay, you should not go for the bright image. You should go for that of the contrast. The sharp image should be seen, which will give you more detail in comparison to that where there is a sorry, bright light is there. Once you have focused this 10x, then you can see the whole complete slide by moving this stage micrometer up and down, so that you are screening the whole slide in 10x. Okay, and then you should see the whole slide by moving it. Okay, and then you just, if you want to see a still bigger image, then you will have to go to the higher magnification, and this higher magnification is here 40x objective lens. These lenses are the objective. Just move this lens to the 40x. Again, when the click image comes, then it means your objective lens 40x is in line. Okay. Now the very important step is that now don't touch this course adjustment. Why you should not touch the course adjustment once your objective lens is in 40x? The reason is that if you move the 40x, I mean say this course adjustment, the stage will go up and down, and since here the slide is very close to the objective lens, the slide will break. After focusing to the 40x, I mean say bringing the lens to 40x, okay, then you should only touch this fine adjustment and then move the fine adjustment in either direction till you get the best image. I have got the beautiful image here, and then I can see the lot of details. Again, the condenser and the diaphragm can be adjusted if you are getting the bright light. Reduce the light so as the more contrast will be seen here. So very important step is that don't touch the coarse adjustment, only move the fine. You see that I am moving the fine adjustment in either direction. Okay, lot of the movements are taking, but your slide is not going to break because it is the fine adjustment which will focus it very nicely without moving the stage of the microscope. So slide is not moving up and down, so it will not touch to that of the objective lens and the slide will not break. Okay, so this is the very important step. In histology classes for MBBS student, we need to focus only into that of the screening objective 4x, 10x and 40x. Okay, if you still want to see the further image, okay, further magnification at 100x, then you should not focus yourself. I will suggest you, because it is eye immersion, you will have to put a drop of the eye and bring the 100x image, and it is little difficult to begin with, because then in that case you ask your teacher to focus for you if you want to see at a 100x. Otherwise you limit yourself only up to 40, which is enough for your studies. Okay, for your study. This is the way how a slide is focused, okay, in the under the light microscope. Now this will not come to you, okay, very in the first step. You will have to study, okay, again and again. So in the beginning we give the 10 days or 1 week just for focusing the slide, to practice the slide, and we ask the student to focus it with the help of the teachers, and within 1 week or 2 weeks at the most they become master in focusing it, and then they don't break the slide. Okay, they can very easily focus the slide. So don't get upset, you will learn it very easily within few days how to focus a slide. I hope that you got the idea about the focusing of the slide, and in the next video I will teach you about how the slides are prepared. Thank you very much for watching this video on the focusing of the slide.